Can we start with the session? Can you update in the chat box, beta? Everyone. Very good evening, Dr. Aman. Can we start with the session? All the students listening to me, kindly update in the chat box all the queries. I have taken all the choices, recall choices from my students. Everybody was saying, but I got the feedback from my students. The MCQs were difficult. Paper was on the difficult side. It was very lengthy paper. All the MCQs were lengthy MCQs, but they were conceptual. They were from our DFX. Maximum students, the feedback, what is common feedback I'm getting from the students. Paper was difficult, lengthy. Some students were saying it was like USMLE pattern, but it was very conceptual, and I will prove that in next 15 MCQs. The questions were very conceptual, straightforward, and PYQs. They were from the previous year topics, previous year MCQs. Clear? So let's start with the first important MCQ. A 2-year-old child with difficulty in breathing, inspiratory stridor, upper respiratory tract. If you go with this diagnosis, inspiratory stridor, it is going for supraglottis. But examiner have given you one slide where examiner is showing you stipple sign. That is your lower part of the stipple sign. That is not a church top sign. So we'll be going in the favor of diagnosis of group. Paper, but this was very easy, straightforward MCQ. So answer will be going in the favor of group. Now, what are the other options? I'll just try to learn better. But tomorrow we'll be having the foundation class, so students for foundation. Clear? So let's start. Epiglottitis. Which keyword? In the examination, either the examiner will use the word कि patient is toxic. Toxic means dangerous. The thumbprint sign, airway compromise, very small airway left. So we have to handle the patient of epiglottitis with care because it is a dangerous patient. Clear? So instead of this triple sign, they will be showing you thumbprint sign. Tuberculosis, TB, larynx. What is the important keyword? They can ask you. They can give you the word mouse, bitten appearance, or they can show you turban epiglottis. These are the two important points. So whenever you are doing what I'm doing, when you attempt the MCQ, every choice, you should rule out the choices. Laryngomalacia. What change in the MCQ? They will remove this X-ray. Inspiratory dyspnea going in the favor. Difficulty in breathing going in the favor. Then the upper respiratory tract infection will not be there. And they will say patient is having dyspnea which improve in prone position. If examiner add the word prone position, I will be going in the favor of laryngomalacia. I hope you are getting my point. So the first MCQ answer will be, that is your group laryngotracheobronchitis. It is viral. Just remember, because in the last INACT, what they have given you, I'm confident all the students who are listening to me or who have attended our DFX, all the classes, those students who have studied religiously, they will pass the exam and they will be preparing for the next INACT. So what was the previous question? They have given you MCQ on group and they ask you which is a causative organism, and all the three options were bacterial. Only one option was there, viral. So it is viral. Always remember, epiglottitis is bacterial, group is viral. Coming on the next MCQ, this was a difficult question. Not clear. 50-year-old female with hard of hearing. I will teach you how to correct this question. My favorite audiometry on tuning fork test. Everybody should reply. What should be the right answer? On tuning fork, Rhinitis was negative. Rhinitis was negative on left side. So first write the finding in your mind. So it is left conductive deafness. I will be going in the favor of left conductive deafness. Positive on right side. Rhinitis positive on right. It means right sensorineural deafness. Agreed? So you tell me, in this condition, Weber will be lateralized to. Weber will be lateralized to left side. Disease ear. Weber lateralized to left side, going in the favor of the diagnosis. So till this, the diagnosis going absolutely right. That is here, left conductive, right sense. Then the examiner have given you bone conduction test. And if you remember in the class, I highlight this point, okay, bone conduction tests are very important. absolute bone conduction test are reduced on right side. Now examiner is giving you ABC. One is absolute bone conduction, one is Schrobeck. That they are reduced on right side. When they are reduced only in one condition, that is sensory neural deafness. So diagnosis going in the favor of, I have to rule out one, either left conductive or right sensory. Weber is going in the favor of left conductive as well as right sensory. But when the examiner is giving you ABC finding, absolute bone conduction finding, that is reduced on the right side. They have not commented on the left side. So it is better to go with right-sided sensory neural deafness. Is it clear? So right answer should be right side, wherever the ABC was reduced. It may be a possibility that they have given you other way around. Rhinitis negative on right side, positive on left side, Weber lateralized to right, and ABC can reduce on the left side. So then it will be left sensory neural deafness. Is it clear? Now correct. One of the students, when I was interacting with our students after the exam, so one of the students was saying, okay, sir, they have given Rhinitis negative on the right side. They have given Rhinitis negative on the left side, negative on the right side, and ABC was reduced on right side. Can you confirm in the chat box, beta, what was the status of Rhinitis on right side? Anyone? Yes, beta, Dr. Aman, Dr. Prem, can you update in the chat box? Okay, Rhinitis was negative on right or it was positive on right. Why? Listen carefully. If it was positive in the right side, then the diagnosis is going straight forward. It is your sensory neural deafness. Even they have given you left negative, Rhinitis negative, and ABC is reduced. This finding is more crucial. ABC, absolute bone conduction test, is reduced on the right side, which is giving me a message. It is right sensory neural deafness. So how can you justify, anyone who can write in the chat box, how can you justify negative Rhinitis in sensory neural deafness? I can justify with the help of false negative Rhinitis. False negative. So here comes the role of false negative Rhinitis. So in either of the condition, answer should be going in the favor of right side sensory neural deafness. Is it clear? चलो रिवाइज कर लेते हैं. Rhinitis positive, normal, sensory and neural. Rhinitis negative means conductive deafness. False negative Rhinitis is severe unilateral sensory neural deafness. Severe unilateral sensory neural deafness. Then Weber, centralized in normal, lateralized to disease ear in conductive, lateralized to normal ear, better ear in sensory neural deafness. Are they comfortable? ABC, absolute bone conduction test. When you block the canal, external auditory canal of the patient, the examiner, it is reduced. Bone conduction is a true marker of cochlea. So it is reduced in sensory deafness. But in case of normal and conductive, it will be same. It will be equal to the examiner because we have blocked the canal. Is it clear? So these are the important MCQs of Audiometry. This is one of the nicely formatted MCQ. In either of the conditions, whether Rhinitis is positive on right or negative on right, answer will be going on the favor of right sensory neural deafness because absolute bone conduction test is reduced. Is it clear? क्वेश्चन नंबर 3 फेवरेट बेटा, याद होगा क्लासरूम में मैंने आपको कहा था हॉलमैन मिलर साइन पूछेंगे या आपसे हिट्सलबर्गर साइन पूछेंगे. दे हैव शोन यू दिस साइन. द पोस्टीरियर वॉल ऑफ मैक्सिलरी साइनस बेंडिंग डाउन. समबडी इज पुशिंग. व्हाट इज पुशिंग? एंजियोफाइब्रोमा. दैट इज योर जुवेनाइल nasopharyngeal एंजियोफाइब्रोमा. क्लियर? दैट इज योर यंग बॉय epistaxis, unilateral epistaxis, recurrent epistaxis, diagnosis going in favor of angiofibroma. Clear? Sinusitis, they will be showing you something in the maxillary sinus. They are not showing some in the maxillary. They are showing something behind maxillary. Clear? Let us rule out other option. Rhinosporiosis. What is the key word? They will mention mulberry-like polyp. If they mention the word mulberry-like polyp, will be going in the favor of rhinosporiosis. Then enteroconal polyp. Enteroconal polyp, it will be coming from maxillary sinus again. Ab batao beta, what will be the appearance? It will be coming from maxillary into the nose, then one part going anterally, one part going posteriorly, and will be having a typical tri-lobe appearance. I hope you are getting my concept. So always rule out the options beta. आपने options को भी rule out करना है. So the answer in this MCQ will be going in the favor of angiofibroma, that is your Hallman-Miller sign. One MCQ was they have shown you a image and they ask you to comment on the pointed structure. Something like this was shown there. Can you write in the chat box beta? This type of slide was there. They have shown something on the lateral side of nose. I tried my best to recollect all the MCQs, choices, images after discussing with the students. Can you update? बेटा ऐसी slide दिखाई गई थी आपको. What is being pointed? It is in the nasal cavity. It is somewhere in the middle meatus. So what is this area? This is the area. All you students listening to me, beta, kindly update in the chat box. What is this area? I am giving you 4 options. Osteomeatal complex. This is the area where maximum ostium open. If you remember, in the classroom we have revised 4 sinus open in the middle. Only posterior ethmoid and sphenoid doesn't open in the middle meatus. 4 sinus open in the middle meatus. And the area where these sinus open along with your uncinate bone in that area is known as osteomeatal complex. So MCQ will be going in favor of osteomeatal complex. What is columella? Columella is this one, lower lateral cartilage. You can touch from anterior. So this cannot be columella. I am showing you some radiology image. So where I cannot comment on the columella option cannot be there. One option, maxillary crest, it will be on the lower part. It is not here at the junction of nose and ethmoid. Even we can rule out this option. And one option was nasal valve beta. Listen, what is nasal valve? Internal nasal valve, Lyman nasi. If you remember, we have learned 3 boundaries: septum, inferior turbinate, junction of upper lateral, lower lateral. So internal nasal valve will be somewhere at the level of inferior turbinate. It will not be somewhere in the middle meatus behind. So osteomeatal complex. The best possible answer in this MCQ will be your osteomeatal complex. Clear beta? Can you appreciate? We are touching the topic. We are extracting the keyword osteomeatal complex. Maximum ostiums open here. This is maxillary, which open in the middle. This area is my ethmoidal group of air cell. Anterior ethmoidal, middle ethmoid open in the middle meatus, while the posterior ethmoid is the only sinus where open in superior meatus. Sphenoid is in the supreme meatus. Is this concept clear beta? Done. So answer will be osteomeatal complex. Coming on the question number 5, integrated question with ENT. And your anesthesia, 4-year-old child with foreign body, suspected foreign body intake. On examination, palpatory third beta. This is a key word, auditory snap or palpatory third. They are related with tracheal foreign body. So how we differentiate the foreign body depending on the symptom. Always remember, if it is in the trachea, what is the keyword? Keyword will be palpatory third auditory slap. What is the concept? This is my trachea. Here is a foreign body. During inspiration, expiration, it will move. So it will create a palpatory third. This is going in the favor of trachea, foreign body, trachea. Clear? Larynx. Complete obstruction. Patient will be having some change in voice because glottic area is the narrowest part. Difficulty in breathing will be there. Aggregate. Hoarseness will be there. So I will be going in the favor of larynx if examiner mentioned these points. Done. Cough, wheeze and diminished air entry. This triad is going in the favor of bronchi. So these are the important keywords. But how to differentiate one foreign body from the other? How we differentiate? Okay, what is the site of foreign body? This was one MCQ in your recent examination. Question number 6 was repeated from your last year NEET examination. They have shown you something in the maxillary sinus. They have shown you some pathology in the maxillary sinus. They have shown you, if I magnify, you can appreciate, they have shown you obstruction at the level of maxillary sinus. Because there is obstruction at the level of maxillary sinus, so diagnosis will be going in the favor of intramaxillary sinus. Am I understandable? Are you getting this point? If you remember, this is important. But a simple funda. Line diagram. This is orbit. What is below? Below is my maxillary. Done. So if there is any obstruction at the level of middle meatus, that is your maxillary. Done. Here is my frontal. upper eyelid swelling going in the favor of frontal, then, and this frontal again opening in the middle meatus. Here is my ethmoid out of anterior, middle, posterior. Posterior is the only area, posterior ethmoidal sinus, which open in the superior meatus. So right answer to this MCQ will be your maxillary sinus. Done. Coming on the next one, 2-year-old child having dinner. Again बेटा इस क्वेश्चन को हम गलत अफोर्ड नहीं कर सकते. 2-year-old child having dinner suddenly become aphonic. What to the casualty with the complaining of respiratory distress with history of some eating. They have mentioned some eating custard apple, or they have mentioned some fruit the child was having. What should be the appropriate treatment? So beta, among these 4 options, if you feel blind finger removal is a treatment, not at all. Never ever take the risk of blind finger removal. This is only used when the foreign body is visible to me. So when it is in the oropharynx and I am confident the site of foreign body, I can easily remove with my finger. But this should not be tried if the child is aphonic. It means somewhere in the lower part. It is not in the oropharynx. Clear? So what is the first method? Will you do tracheostomy or cricothyrotomy? Not at all. First, I will try my best for Helmich maneuver. But many students were asking me during the discussion, yes, a 2-year-old child. Yes, we can do. No worries. So method, we will hold the baby in such a way. The palm will be supporting the chest. And then we will be pressing the baby neck. Am I understandable? Clear? So this will be the right answer. This is often repeated. Every examination of FMG, they ask you this Helmich maneuver. So the D option was the right choice. Clear? Coming on the next one, again a PYQ from NEET exam 2022. What they have asked you? Merciful anosmia. If you remember na beta, मैंने आपको क्या कहा था class में, if you don't have any time to revise atrophic rhinitis, just revise 2 words: roomy nasal cavity. If the word roomy nasal cavity or merciful anosmia. What is merciful anosmia? Patient himself is not having the perception. Why? Why he's not having the perception? Because there is a atrophy of mucosa, atrophy of nerve fibers. Because there is atrophy of mucosa and bone, foul smell is there. Because there is a atrophy of nerve fiber, patient is not having the perception. Therefore, merciful anosmia is the key word for atrophic rhinitis. बेटा इस क्वेश्चन को भी हम गलत अफोर्ड नहीं कर सकते. Am I understand? But roomy cavity, it is associated with Klebsiella. Just remember this point for all the upcoming NEET exam, INACD exam, or even all the students who are preparing for upcoming NEET exam and they're listening to me. Just remember, beta, Klebsiella. What is the differential diagnosis? Klebsiella in rhinology knows rhinoscleroma and atrophic rhinitis. How you differentiate? The key factor is your merciful anosmia. If merciful anosmia is mentioned, that is atrophic rhinitis. If they mention the word woody nose, if you remember, woody nose going in the favor of rhinoscleroma. Woody nose, rhinoscleroma. Done. So this question may say, if I remove the word roomy cavity, I remove the word merciful anosmia, I add the word woody nose, I add the word very foul smelling like carpenter glue, I will be going in the favor of rhinoscleroma. Is it clear? Rhinitis medicamentosa. What is this word? This word is withdrawal phenomena. If you are taking overuse of vasoconstrictors, the patient rebound phenomena. And what is the treatment? Topical steroid. So we have discussed all the type of rhinitis in the classroom, if you remember, and I highlight this point. Merciful anosmia matlab atrophic rhinitis. याद है बेटा? Atrophic rhinitis is equal to merciful anosmia is equal to roomy cavity. याद होना चाहिए. This is again a PYQ which was there. Question number 9, they have asked you, this was a new MCQ. They have given you a slide. Beta, MCQs were lengthy. I have just concised those lines and I am giving you the concept on which they have asked you the question. Clear? Then they have given you one structure, if you remember. This type of image was there and they have asked you something on the layer of the pharynx. So first of all, beta, we will start from here is my oral cavity. This is my lumen. If this is my lumen, this will be your tonsil, agate. And what they have given you? They have given you lateral wall of the pharynx. Lateral wall of the pharynx. So beneath mucosa, if you remember, याद है बेटा क्लास में हमने layers of pharynx याद की थी. If this, they have asked you the first layer. What is just beneath the mucosa? Just beneath the mucosa is your pharyngobasilar. And outer is buccopharyngeal. Just remember this point. So they have given the arrow on the outer one. So what is outer one? Outer one will be here. Is it posterior pharyngeal wall? Not at all. This option was repeated. Posterior pharyngeal wall. The first option was pharyngobasilar. And second option was buccopharyngeal. So the outer one is always your buccopharyngeal fascia. Posterior pharyngeal wall to पीछे होगा ना बेटा. It will be on the posterior side, not on the lateral side. So inner one is pharyngobasilar, outer is buccopharyngeal. So this was again a integrated question of ENT with anatomy, and we have discussed this question nicely. Coming on the 10th MCQ, comment on the tympanoplasty. Examiner have given. This time they have taken good efforts. They have drawn the images. So many students were telling me, examiner ने खुद draw की थी और वो image दी हुई थी. So they have given you something like this. Now what is the concept? Tympanoplasty. First of all, beta, your basic concept should be clear. Tympanoplasty is the treatment for safe ear. Tympanoplasty is the treatment for safe CSOM. That is which CSOM? Tubotympanic CSM. Tubotympanic CSM. Then what we are doing, we are keeping the graft. If along with the graft we are keeping the prosthesis, we call it as tympanoplasty with OCR. What is OCR beta? Ossicular chain reconstruction. Now depending on the graft, where we are keeping the graft, we label it as type 1, we label as type 2, type 3, type 4, type 5 tympanoplasty. Type 1, when all the ossicles are intact or there may be some injury to the malleus, but you are keeping the graft over malleus. If I keep the graft over malleus, it is type 1. If my malleus is damaged and I am keeping the graft over incus, then it is type 2. Even incus is damaged, we call it as type 3. And if suprastructure is present, it is type 3. If suprastructure be damaged, only foot plate is there, I will be going for type 4. And even foot plate is damaged, I am keeping on the promontory on the semicircular canal, it is here type 5. I hope you are getting my point. Even type 6 is there, but clinically we always do up to type 4. MCQ purpose, even type 5, type 6 are there. Now concentrate on the board. You people will reply in the chat box where the graft was. Malleus incus was not shown. It means which options rule out? You tell me. Option 2 is out. Option 2 is on the incus. Now question is, the examiner have shown you the complete stapes, or they have only shown you the foot plate. If examiner have shown you alphabet C, now just try to learn. If they have shown you what is the shape of stapes, suprastructure of the stapes and foot plate. If you remember, we have drawn all these line diagrams in the class. If they have shown you suprastructure, if I am keeping the graft over the suprastructure, incus is gone, I am keeping over the stapes, tab to ho gaya beta type 3. Now if they have not given you the alphabet C is not there, they have only shown you the foot plate, that will be your type 4, which is known as minor cavum. So most of the students were saying that they have shown you something flat part. If they have shown you flat part, it is means it is foot plate. If it is foot plate, we'll be going for type 4 tympanoplasty. Am I understandable? Even if the foot plate is damaged, all window is there, then we'll be going for type 5. Is it clear? So the right answer to this MCQ will be your types. They can even ask you the name, like type 1 is known as myringoplasty. What is type 2 known as? We call it as myringoinkidopexy. Incus पे रख रहे हैं तो we call it as myringoinkido. What is type 3? Myringostapedopexy. If we keep on the foot plate, like in this condition, it is known as minor cavum effect. Minor cavum effect. Is it clear? And type 5 is known as fenestration or oval window. Simple fund hai beta. With the help of line diagram, we can crack this. Question number 11. If you have attempted our CBT, FMGE CBT, in which I have given this MCQ, this is a old PYQ of NEET exam. Patient is having seizure Altered sensorium means CNS involvement. On examination, he is known case of CSOM under treatment. Immediate CT was shown. They have shown you this CT examination. बेटा अगर याद है आपको क्लासरूम की एक बात, examiner can either show you a ring or they can show you a triangle. If they show you the ring, we are talking about which patient? We are talking about chronic suppurative otitis media. If examiner give you a patient of CSOM and he want to make an integrated question with ENT and radiology, तो बेटा उसका दो ऑप्शन है, या तो एक रिंग देगा आपको तो आप क्या टिक कर देंगे, टेम्पोरल लोब एब्सेस. That was the right answer in this MCQ. Or they can show you some empty delta sign, lateral sinus thrombophlebitis. So in this MCQ, it was temporal lobe abscess, second most common complication of CSOM. Better tips we are most common extracranial, most common overall mastocytitis, most common intracranial meningitis, second most common abscess. Which lobe is most common site? Sir, temporal lobe is the most common site. याद है बट ये सब कुछ हम पढ़ चुके हैं. Graph. They have shown you these two graphs in the one is pure tone audiogram. ऐसा एक ग्राफ दिखाया गया था. याद है बेटा हमने आपको I make you revise 2 to 3 times in the class itself all the 10 graph of pure tone audiometry, and they have asked you the simplest one graph within 25, one graph beyond 25. So what the diagnosis, you people tell me? Airborne gap shown. If airborne gap is shown, it is conductive deafness. Then they have shown you one tympanogram. What is this tympanogram? So this is flat tympanogram, also known as B tympanogram or flat. There is some extra fluid in the middle ear. So again, diagnosis going in the favor of conductive deafness. So बेटा अगर यहाँ आपको ये दिखाया, the many students were saying both the graphs were given. If both the graphs are shown to you, that is going in the favor of conductive deafness. Conductive deafness. Is it clear, beta? All the type of tympanograms should be on your tips. A is normal. A is normal. If the examiner show you something like this, ये क्या है बेटा? Hypermobile. A D. If they show you something hypomobile, that is known as AS graph. If they show you some flat tympanogram, this is known as B or flat tympanogram. B or flat. And if the graph is shifted on the x-axis, it is known as C tympanogram. All these graphs should be on your tips. Is it clear? Coming on the next MCQ. This was a nice question, nicely formatted question. 56-year-old patient, they have given from northeast. What is the keyword? Northeast. Yes, you tell me. Commonly, which malignancy? Nasopharyngeal carcinoma. Hearing loss. Facial numbness. Why? Because cranial nerve involvement. On otoscopic examination, tympanic membrane appeared to be dull. Tympanometry B-type tympanogram. They have shown you B-type tympanogram. Neck examination, lymphadenopathy on right side. What is the keyword? If you remember बेटा मेरी बातें आपको अगर याद हैं, unilateral foul smelling nasal discharge, foreign body, unilateral cervical lymphadenopathy, nasopharyngeal carcinoma, आना ही आना है, angiofibroma, nasopharyngeal carcinoma. So diagnosis is nasopharyngeal carcinoma leading to glue ear. Examiner can ask you investigation of choice, Trotter's trad. We are talking about Trotter's trad. So investigation of choice should be MRI, but examiner is asking you most appropriate treatment. This was very tricky question, beta. Even on the day of examination, evening when we were conducting the recall session, many students they say, "कि sir, answer should be grommet with steroid or maryngotomy." Not at all. No grommet, no maryngotomy, beta. This is nasopharyngeal carcinoma. और क्या concept हमने क्लास में build up किया था? Angiofibroma. Treatment is surgery. Nasopharyngeal carcinoma, radio and chemo. याद है? The answer will be radiotherapy. Here I am treating the tumor. That tumor is causing your glue ear. So my priority will be B option, radiotherapy. I appreciate the examiner who made this question. Answer will be B option. Answer will be in this MCQ, B option. Chinese population, Epstein-Barr virus, fossa of Rosenmuller. These are the important keywords of nasopharyngeal carcinoma. After the discussion, beta, you will realize this point. Paper was not difficult. They created pressure by lengthy choices, lengthy MCQs. But if your basic hardcore concepts are strong, So you can attempt the question. But wo din chale gaye when they are asking one-liner straightforward MCQs. Take my word, all these students listening to me, better now they have changed the pattern. They are asking very conceptual MCQs. So please work hard on the concepts. Clear? Coming on the next MCQ, this was the easiest question. They have shown you something on the filter paper and they ask you which sign. Beta 2 transferrin, no, that is electrophoresis. That is your electrophoresis finding for CSF rhino. It is related with this patient, but not, this sign is not. Handkerchief, you sinusitis patient, the sticky nasal discharge, double ring sign, halo sign, target sign. Beta, this is the oldest PYQ, last 10 years question. This question repeated multiple times. So answer will be double ring sign, target sign, halo sign. CSF rhinorrhea, cause, endoscopic trauma, treatment, wait and watch. These were the important basic points. One MCQ, the 15th one was teardrop sign. They were integrated MCQ of ENT with your ophthalmology in blood fractures. Done. So these were the important concepts. They have asked you hardcore audiometry. They've worked, they have given you B-type tympanograms. They ask you absolute bone conduction test and they ask you such a nice conceptual question. So beta, best wishes for your result. I am confident the students who work hard, the effort will not be wasted. You will be definitely passing your examination. Best wishes. We all are waiting for your results. Best of luck. Any query you can ask me, you can tag me on the Insta or you can write in our Instagram group. Thanks a lot for listening to me. We stop at this point. Thank you.